November 2021. Just to make you all aware, today's meeting will be recorded. Can I also welcome any members of the public and press to today's meeting? Can I kindly ask you to observe the meeting only and not speak or participate? Can I please remind you all to switch your phones to silent for the duration of the meeting? In addition, can I refer you to the protocols for remote meetings which have been previously circulated? Namely, your microphones should be switched to mute unless you are speaking. Should you wish to ask a question or make a comment, can you please indicate either via the chat function or by raising your electronic hand via Teams? I will assume that you have all read the paperwork before us today prior to the meeting. Please only use the chat function to indicate if you wish to speak as an alternative to the electronic hand function or to raise any technical issues. When asking a question, can you please indicate which page number you are referring to? So the first item on the agenda is to do a roll call. I am Councillor Lynette Purcell, the Chair, and I am present. I will now call on Charlotte, the Democratic Services Officers, to take the roll call.
Thanks, Chair. I will mark you as present. Bear with me just 2 seconds. So then if I move to the Vice Chair, Councillor Charlotte Galsworthy. Councillor Galsworthy. Is Councillor Galsworthy there? Sorry. No?
She was complaining earlier that signal was dropping in and out, so.
There we are, not a problem. Councillor Arthur Davis.
Present.
Councillor Oliver Davis.
Present, thank you, Charlotte.
John Miller.
Present, Charlotte.
Councillor Suzanne Padson.
Present.
Councillor Sonia Reynolds.
Present.
Oh, I've had apologies from Councillor Dave Whitlock. Councillor Alwyn Wilcock.
Yes, present, Chair, and thank you, Charlotte, for sorting out my private papers.
Not a problem. Councillor Carolyn Edwards. I know she's having help at the moment accessing her papers, so I know she's in the meeting. So I'll mark her as present. Councillor Wyndham Griffiths.
Present.
And Kerry Clark. Chair, I've actually had apologies from Councillor Clark as well. Sorry about that.
Okay.
And Councillor Nicola Davis.
Present, Charlotte.
And if I move on to Cabinet members, Councillor Alan Lockyer.
Councillor Lockett's with apologies and I'm here instead of him, Charlotte.
Oh, Councillor Leanne Jones, is it? Not a problem,
yeah.
I'll mark you down now. And then Councillor Peter Richards.
Present, Charlotte.
And then if I move to officers, Andrew Jarrett.
Present, Charlotte.
Angela Thomas. No. Kerry Warren.
Present.
Hayley Short.
Present.
John Hodges.
Present, Charlotte.
Nicola Heedon.
Present, Charlotte.
I'm just checking if there's any other officers. Shelley Howard.
Present.
Chris Frey Davis.
Present.
And I think that's everyone. Have I missed anyone at all? No, then Chair, that's everyone. Thank you.
Thank you very much. So the next item is the Chair's announcements, and we have decided to scrutinise items 7, 8 and 11 on the Social Care, Health and Housing Cabinet Board papers, as well as the impact of COVID-19 on the sustainability of older people care homes in Neath, Talbot on our scrutiny agenda. Thank you. So the next item is declarations of interest. Please indicate if you have a declaration of interest by raising your electronic hand. Charlotte will circulate a declaration of interest form virtually for you to complete. I don't see any indications. Do you see any?
No, I
Charlotte?
see none, Chair.
Right, fine. Okay, so now we can move to our actual agenda and the minutes. If you have a look at the minutes of the 29th of July, we did have one question, which is on page 6. It says, it was confirmed that the Ammon Valley was not included in Appendix 2 of the report following the work undertaken by the Opinion Research Services, as they did not identify any need for additional housing in the Ammon Valley. Now, my memory is that that question was actually asked by Councillor Dave Whitelock, and it was asked about the Avon Valley, but we really need some sort of confirmation of that. The Democratic officer thinks it was Councillor Whitelock that asked it. He unfortunately is unwell, so can't confirm it. Officers, do you have any memory of this? Blank faces all round. In that case, we'll just have to go with my memory and the Democratic Services Officer that it was the Avon Valley that was being referred to, and that amendment will be made. Can I have an indication that we approve the minutes, please?
Chair, I can see as well, sorry. Councillor Reynolds just put her hand up as well, so I'm just thinking she might be able to provide a little bit of clarity as well.
I can't see her on my screen. Is there any reason why not?
I just took it down again because I thought, oh, well, it's gone the right way. As far as I didn't raise it, and I don't know if Arwin can also confirm. And it would have been one of us two, I would have thought.
Yeah.
If it was the Avon.
So we're pretty sure it was Dave Whitelock, and he was talking about the Avon Valley, so that will be amended. So can I have the confirmation that with that alteration, we're happy to accept the minutes?
Move, Chair.
Cabinet member, did you indicate?
Yeah, Chair, just to confirm that it was David Whitelock did raise it on the Avon Valley, and I think the officers responded with regards to the complement of unoccupied premises that were there presently. Thank you.
I thought I'd remembered it correctly. Right, so just for the record, we are now confirming that those minutes are accurate. Sorry, Suzanne, can you?
I move, Chair, yeah.
Thank you.
Thank you, Chair.
Yeah, thank you ever so much. Brilliant. Okay, so now I'll give you 2 minutes just to organise your papers to get on to the Cabinet papers, and we'll start off with Agenda 7, the Safeguarding Annual Report. But just give us 2 seconds, including myself, to get onto the right papers. Okay, let's just do this. Okay, we're nearly there. Right, Safeguarding Annual Report. Okay, officers, is anybody going to say anything before we begin?
No, Chair, from my point of view, the report is as it is. Happy to answer any questions. I've got Chris Ray Davis, our lead safeguarding officer, here today. So, yeah, we'll open it up to questions if that's okay, Chair.
Brilliant, thank you very much. So as the chair, on behalf of the committee, I just wanted to welcome the Youth Justice Early Intervention details on page 61, the fact that young people are engaging and shaping their own safeguarding plans, and the Junior Safeguarding Board referred to on 71-72, which is engaging young people from across all areas. And we were particularly impressed by their initiatives, such as the Stay Safe in Sport initiative, which hasn't been something that's been imposed on them by adults, but it's something that they personally are concerned in. So we were impressed by that. So we have some questions. On page 36, in the priority outcomes for 2021, it says, you state that you wish to obtain a clear picture of the spread and impact of COVID and to preempt safeguarding issues arising, i.e. an increase in unsafe hospital discharge, care home pressures, etc. So we were just wondering, when were these priorities set? And when you acquired this suite of data, how was that then used to improve safeguarding? In other words, in layman's terms, what did you do with the information when you had it? So we'd just like a little bit of, if you could just expand on that a little bit, we'd be very grateful.
Yeah, I'm happy to take that question, Chair. The plans ordinarily go in April. So prior to this plan, we had set our priority outcomes against work we'd been undertaking the previous year. We were then obviously faced with the pandemic, and we changed plan overnight, I would say, to be fair to the board, whereby we felt it was important to ensure a robust, resilient and consistent approach to safeguarding. And we felt it was important for what we understood at the time to understand how the virus were to spread, because there were many questions at the beginning which none of us were clear on kind of what the impact would be, but we felt it was really important to understand how it was spreading, and indeed how then we could try, if at all possible, to kind of keep ahead of the curve, to start preempting matters that were to arise and impact on safeguarding, essentially. Much of what we did in terms of data, the data was incredibly difficult to get out of the system because everybody was so busy responding across respective agencies. So what we did very quickly is convene groups across children's and adults, whereby partner agencies came together to share essentially real-time information from the ground, so we could just start to see and patch together that kind of information, some anecdotal, as to where we needed to respond.
Thank you for that. On page 66, it says the SCVS, which from my memory is the Swansea Council for Voluntary Services, reports that they put out a call to staff to support care homes at a point of crisis as part of the Regional Partnership Board Care Home Cover approach. But that offer of support was not accessed, and we just wondered if you could give any more details about that.
Yeah, certainly, Chair. I've followed this up with Swansea SCVS, so they've come back actually this afternoon. What I would say is that SCVS offered to support the situation using staff internally by putting a call out to the sector. The offer was for staff with health or care experience willing to support care homes and others to support ancillary roles. The response was at the time that the RPB put emergency measures in place via the emergency care home standard operating procedure, which then ensured that there were systems in place, which meant that the third sector could be stood down, albeit they'd done some preparatory work to identify staff that might be needed to give us some support if required.
Oh, thank you very much for that. I had no other questions indicated during pre-briefing. I can see the director. Were you indicating?
Only a follow-up to that answer, really, which Chris gave, which was committee will remember that we told you during the height of the last peak that we'd had to use some of our own staff to go into care homes. Well, it was if we hadn't got enough staff that we were going to have to use other staff from other organisations. As it happened, we did have enough staff to cover it, and therefore we didn't need it, and neither did Swansea.
Oh, thank you very much for that clarification. We had no more questions from the pre-briefing. Anybody want to ask anything now, or are we okay? Can't see anybody, which is excellent. There's no recommendation. This is just for noting. So that moves us on to agenda item 8. Again, anybody presenting this, or do we just go straight to questions? Looks like straight to questions. We had no questions on this, just one observation. So we just need clarification about the date that this was written. On page 91, it refers to Aled Evans as the Director of Education. Now, that's understandable if it was historic, but if it's not historic, if it's supposed to be current, then that needs altering. Yeah? Anybody?
This chair was written at the time Aled was still in post, so there was just some crossover. Probably a month later he left, so it is correct, Chair.
Okay, brilliant, thank you. Now, this is a recommendation that we are happy for this to go to Cabinet in its present form. Can I have a proposer and a seconder, or a lot of thumbs up that we're happy for this to go to Cabinet?
Move, Chair.
Thank you. Anybody else? Nicola, brilliant. Is this a question, Nicola, or are you supporting that it goes to Cabinet?
Just supporting it goes to Cabinet.
Thank you very much. Okay, smashing. So we're now on to agenda item 11. I'll just give you a couple of minutes to get to that on your papers. I'm glad we've managed to get through 7 and 8 quite quickly, because we've got an awful lot to ask about agenda item 11. because it impacts on the entire area. So from the very beginning, here we go. Anybody want to say anything before we begin? Any officer? No? Okay. Having read the proposals on which the consultation ended on September the 12th, that's 4 days ago, 2021, we note as a committee with concern that the consultation has concluded. We're wondering whether it would have been possible in hindsight for the committee to have been able to respond to the consultation, and which stakeholders were actually consulted. If we weren't consulted, who were the health board consulting? Can anybody answer that one for us, please?
Chair, I can answer part of that question, and that is that you still have an ability to respond to the consultation via the community health councils. So there is opportunity for the scrutiny committee to submit something there.
Brilliant. That's excellent news. Thank you very much. The committee felt, being the Social Care, Health and Wellbeing Committee, that perhaps we ought to have been invited to take part in the consultation formally. We just wondered, is that not normal practice, or was it an oversight, or were we not normally consulted anyway? We will be responding, obviously. Andrew?
Yeah, I don't think it's too late for the committee to do and to ask for whatever you think you need. So if you felt it was important to convene a further scrutiny meeting with health present, where they are explaining this to you and accepting your questions, then absolutely we can still go away and do that. So none of that is out of time as far as I'm concerned, and I'm sure health would agree to doing that if you felt that was needed. There has been lots of, there's been lots of stakeholders that have responded. I haven't got the list of those stakeholders, I'm afraid, but health will have, and as I say, they we are one of their most important partners, and they will want to hear from us what it is that we think about this. And if scrutiny want to take an active part in that, we could set that up very quickly.
Excellent. In that case, with committee nodding, I think, we'll go through the questions that we did have. We'll see if the officers are able to answer any of them. If the officers aren't able to answer them, then our original plan in pre-briefing was then to write a letter to the health board. Yeah. Depending on the response we get to that letter, I think looking at faces on the screen, we would be quite keen to have a meeting with the health board to thrash out some of these areas of concern that we have. So please bear with us, officers. If we ask the questions, you may well not be able to answer them, but if we can just ask them first, because we are scrutinising this report in front of us today, which has given rise to some questions. And if you can't answer them, don't worry, we'll put them in the letter, and if necessary, we will probably be meeting with the health board. Okay, this is the first question, and do butt in at any point, indicate, committee, if you want to add anything else. Right, on page 164, it says, there is a lack of confidence from commissioning colleagues, that care homes could be a replacement for hospital care. Has that worry been put to the health board by officers, and what was their reply? Is that Angela? Hang on. Sorry, can you just pause 1 second, everybody? My computer's being difficult, and I can see Angela now. Right, carry on.
Yeah, I've submitted a response on behalf of Adult Services voicing those concerns. I've heard nothing back yet. And we've also drafted a letter on behalf of the Director to the Chief Exec of Health. I'm assuming they'll come back to us at the end of the consultation period.
Right, so that is the sort of thing that you would like as a committee for us to include in our letter as well. Yeah.
Yeah.
Okay. Democratic Service Officer, where are you? Are you keeping note of all of this? Yes?
Yes, Chair, and it's obviously being recorded as well, so it'll all be fully noted. Because
there are going to be lots of questions. Oh, and I can see Councillor Edwards indicating yes, Carolyn.
Yes, thank you, Chair. Top of that page 164, it says the consultation document points out that there has been an investment into community services. As a retired health visitor, I know for a fact that it never, ever increase in community services. So, you know, this lip service to that, isn't it? They never, ever put more staff in. Thanks.
So did you want to ask a specific question, Caroline? Or was it just a comment?
It was a comment, but I think, you know, as we've said further on as well, these are the things we really need to be looking at, because it's going to have a huge impact on our social services and wellbeing, you know, services. Yeah, thank you. That was me.
If you take that comment and construct it as a question, perhaps you would be wanting, not that I'm putting words into your mouth, perhaps you would be wanting to ask the health board for evidence of this investment in the community. Yes?
Yeah.
Happy? Committee, are we happy? Are we nodding? Yes, good, right, fine, excellent. Charlotte's got that one. Right, okay, page 163. You state that, sorry, the report states that 24-hour care will be required in care homes for those who would have been historically admitted. We also note on page 175, the health board itself states that it will be providing support and specialist input into care homes. So the question is, where is the money coming from? And again, has that question been asked of the health board? And if so, what was the answer?
Again, Chair, that's been included in my response to the health board. We haven't had an answer yet. So to put it into context, what we're seeing is far more how do I say, difficult people being placed into residential care, and the care homes themselves are unable to deal with the complexity, to the point that we've had to put our own staff in, particularly where people have got heavy end dementia. The homes are not resourced in the way to deal with this form of complexity. So that's all been passed on to health, but we haven't had a response yet.
It does look as though we need the health board to this committee to answer some of these questions. I know Councillor Wyndham Griffiths wanted to ask, and then I can see Arwin indicating. Wyndham. I think you're muted, Wyndham.
The document states that there will be 75 EMI beds in the region, and that's not a lot for the whole length of Swansea and Neath Talbot. Now, it also states that they'll be placing people into nursing residential homes where and when. But my question is, when somebody is placed in a nursing home, nursing care is given, but it comes to a point that perhaps that particular nursing home hasn't got the specialist nurses when somebody goes, you know, the condition deteriorates. Speaking from experience, we used to then get specialist nurses from Tonna, and they would be admitted to Tonna for a while and then brought back. Now, if we'd only got 75 beds throughout the region, if and when this occurs, where are these people going to go? Because I can't see them being empty beds. And looking at it again, it says there's only one specialist EMI nursing home in the region. So to me, this hasn't been thought out at all. It's just the health authority showing we are good guys, and in the end, Angela, we are going to catch the money. We are going to be paying for it all. And the health authority, in the whole document, I think it's only one sentence comes in with the continuing care. It's not there.
So I think, again, without wishing to put words into your mouth, Wyndham.
Sorry for the preamble.
Yes, no, it's okay, no problem. Only for clarity, I think the specific thing that you raised with your experience, which we really value, is if you've got somebody in a nursing home who hasn't got dementia and who then develops dementia, and that nursing home doesn't have a specialist dementia nursing, the option of taking that person to Tonna for respite and for care and for creating some sort of a structure is going to be removed, and what is the health board going to replace that with? Is that basically it?
Yes, really. It's when people deteriorate.
Yeah.
I mean, it's a long time since I was there, but normally a nursing home would be able to cope because of trained nurses, right? Probably not a lot of a mental trained, but they were trained nurses. But the residential home, there's no trained nurse in there, and to get the district nurses in, I mean, well, we all know what it's like. It just doesn't add up. You know, if I can, they've written a document, and I don't think they've taken into consideration of the population.
Right. Thank you for that, Councillor Griffiths. I can see Councillor Woolcock indicating. Have you managed to retrieve your notes, Arwin?
Yes, with thanks to Charlotte, Chair, I did, or she did manage to retrieve the annotations that I'd made, so that, you know, that's been very, very helpful. I just wanted to point out, Chair, that you made reference to page 164, and that second part, that large paragraph there, and the sentence that struck me was, and I quote, "There is a risk that this trend will increase, resulting in additional costs for the local authority." And the comment I'd obviously like to make on that, you know, that this is yet another example of local authorities picking up the tab following poor decisions taken by the Health Board. Now, I note that the Director of Social Services, Health and Housing has written to the Chief Executive of Swansea Bay University Health Board, but I think this committee's concerns should be added to that as well. That's just the point I wanted to make, Chair. Thank you.
Excellent. Thank you very much for that, Arwin. Director, I can see you indicating.
Yeah, thanks, Chair. I think what we've done by putting this before you is giving you the information without actually giving you then the further information, which is what we've responded as officers. So we've sort of, as we're summarising the report, we've given a view which you know will accord with your own. I think you probably need to see our responses. I agree with Councillor Woolcock, you know, that there should be a letter from the committee if you feel strongly, which I'm sure that you do. And as I said before, you may want to call representatives from the Health Board to answer some of these questions specifically in one of your committees in the future.
Definitely. Right, okay, there were a few more questions from pre-briefing. Let's just see how we get on. Suzanne, you had a question about statistics.
Yes, thank you very much, Chair. The paragraph starts at 177, goes over the page. And first of all, I wanted to ask, the figures per 100,000, underneath it says taken at the end of September 18. And I wondered if these were the right figures to be considering now, because by the time this is implemented, it could be 4 years on, plus 2 years possibly of a pandemic, where mental health in the elderly will, I do apologise, where mental health in the population may have decreased severely because of the pandemic. So that was the first point I wanted to make. But in the paragraph on 178, they use those very figures to say that they have too much money and staff resources tied up in hospital beds, which they say are irrelevant, they're not being used. And their answer to it is to leave people in their own homes covered by community settings. And the point I wanted to make is that once again, the local authority are going to have to sort of step in here, in that a lot of these mentally ill elderly patients may not have any relatives that are looking after them, either living close by or whatever. And I have had personal experience of what happens when an elderly person with mental health issues is left in their own home. They can cause havoc with the local community. So as much as I'm not in any way blaming those patients. They will not be able to help the symptoms they have, or what it makes them do. But there are people who need to be nursed in a secure, safe environment, so that at the very least they don't harm themselves. So I don't think this is the right approach at all, to leave people once again in a community setting where perhaps they will have a small amount of visits in a day and the rest of the day, just left to themselves or their own devices, or maybe family. I think this is going to cause a lot of problems within communities.
Thank you. Thank you. And you'd like that included in the letter when we write it. Can I just ask for clarification? On my screen, popped up an indication of somebody from Swansea Bay Health Board. Did you get that message, Democratic Service Officer? Yeah.
Yeah, we've seen that. We're working in the background to explain we're in scrutiny.
Excellent. Okay. I shall leave it in your capable hands. Right. Okay. Where are we up to? Yes. Page. Oh, Angela, you're indicating.
Sorry, Chair. Was that Sarah Waite who's joined the committee today? Is that where it's come from?
Yeah, Sarah Waite, she's joined Cabinet Board. She has. We're explaining we're in scrutiny to attend this meeting if she needs to.
Yeah, well, yes, just so that you're aware, Chair, Sarah Waite is taking up post with the local authority on the 9th of October. She will be the principal officer for communities, local area coordination, etc. So she was coming in today to see how we operate as a committee.
Oh, more of an observation, is it?
As an observer, yes.
That's fine, not a problem.
So she's observing this committee now. Yeah, okay, fine. Yeah. But not contributing. No? No. Right, just as long as I know what's going on, which would help. Okay, page 188, it states, it states that the health boards state that they are working with our local authority partners. Again, we just wanted confirmation from the officers that you do feel, in fact, that they are working with you rather than making decisions and not taking note of what you are saying to them. Anybody want to confirm that or comment on that? Angela, sorry to put you on the spot.
Sorry, Chair, I'll choose my words carefully.
Indeed.
The director might be better at saying this than myself. This consultation commenced before the pandemic. It was then put on hold and then recommenced. Prior to the pandemic, Adrian Bradshaw, who's with us today, was asked if he would chair a part of this group, and I'll let Adrian explain. But when this was produced, it was a surprise to Adrian, myself and others that, no, I don't think we've been formally consulted on the content of what's been produced. Adrian, do you want to comment? Yeah, Adrian's with us.
Thank you. Adrian?
Yeah, just to, there is a dementia and older people mental health modernisation group that I've been chairing. It's been on and off because of the pandemic, so it was stood down, then it was stood back up. So there has been some work done around looking at modernising older people mental health services, which would include this. But the actual decision about the closure of the beds in Tonner, we haven't been involved in. The group that I chair had a presentation from somebody from the health board advising us of this consultation, basically saying that they've gone into consultation and giving us an overview of the consultation. But we certainly haven't been involved in any of the decisions about the closure of any beds at Tonner or any of the other sites in Ward G, for example. So, yeah, so we have been involved in discussions about the modernising of older people mental health services, but not directly involved in any decision making or plans for any closure of any beds.
Thank you for that very clear explanation, Adrian. We appreciate that. I can see Councillor Goldsworthy. Oh, Angela, did you want to follow on from what Adrian has just said before I go to the Vice Chair?
If I may, Chair, just to say that Adrian is going to stand down as the chair of that group because we think this is a conflict of interest. It wouldn't be right for Adrian to be representing the council on something that we possibly don't agree with the decision making.
Again, thank you for spelling that out, Angela. That is appreciated, and I can see the committee nodding. Right, Councillor Goldsworthy, did you have some questions?
Yeah, I got plenty of questions and comments, but obviously as this is a public meeting, I'll save a lot of it for obviously discussions after the meeting or another day. I think there's been a lot of things said. Obviously, I sit on the Health Council, and there's been a lot of things said there that are contradictory to what staff from the hospital who work in them, areas say, and obviously what the consultation says. So I think there's a lot of work and statistics that I'd like from our side, in the sense of my biggest concern is that they haven't done a full consultation, as in, well, more of a survey of where we are with mental health now, because there's still a lot of undiagnosed people out there. There's still issues that we haven't picked up. They're not in our services. And again, it seems a lot more pressure on ourselves than obviously there. Lots of comments were made that work has started on painting and decorating the wards already. But then when there was a protest of patients outside, that work is now stopped. So there's a lot of contradictions about this, and I think there's a lot more to explore. And there's a lot of other concerns that I want to raise outside of this meeting.
Thank you very much for that, Councillor Goldsworthy, and I'm sure the officers will look forward to receiving those questions. I can see Councillor Paddison indicating.
Thank you, Chair. It was remiss of me. There was a second bit that I should have done when I made my comment about care in the community. I believe that the committee are all thinking along the same lines, that we should indeed write a letter to the Health Board, spelling out our, I can't think of the word now, how we can not be included in this consultation is beyond my comprehension. But also, I really do want to propose that we ask a member of the Health Board to come to committee to speak with us about it, as the director indicated was possible. So I'd like to move that we write a very sternly worded letter, and B, invite them to come to committee to discuss the matter.
Right, okay. Democratic Services Officer, where have you gone? You have disappeared off my screen. Right, there she is. Right. Do we do these as two separate items then? The letter and then the meeting?
Well, what I would suggest is, if you wanted to send the letter, and in the letter you could always invite them to come to a special meeting. So I would probably do it as a whole, if that's what the committee was inclined to do.
Okay, before I go to that, because that really concludes this part, I can see there may be other people wishing to ask questions or to contribute, and I can see Councillor Miller indicating. So can I put you on hold for a second, Councillor Paddison, with that proposal? Yeah, whilst I just make sure we haven't missed anybody out. Councillor Miller.
Yeah, thank you, Chair. After working in the health service for over 30 years, I think I've got a clear idea of how they work. Can I say that to invite them to a meeting might not be the right way to do it? I think we should summon them to a meeting, as is the right of this committee. That way they've got no reason to not turn up. And the thing is, I quite agree that sending them a letter would be fine, but you've got to understand letters go missing. Thank you, Chair.
Thank you for that, Councillor Miller. Right, Councillor Edwards.
Thank you, Chair. Yeah, I missed a couple of pages, but it doesn't matter because I can write a lot of these questions down. I'm very concerned, regarding the loss of beds. I think that's very important. Also, everything seems to be getting centralised in Swansea and far away from us in Neath, Talbot, particularly those of us that are at the top end of the valleys. And the page 181, they're talking about Ysbryd y Coed, which is Cefn Coed. I mean, Cefn Coed is an absolute nightmare to get to, even with a car, So I despair for patients, their relatives getting to places like this. There's no equality then, if you like, of the share of the services in this document either. Thank you.
Thank you for that. I can see Councillor Goldsworthy indicating, unless it's a legacy hand.
No, it's me.
No, you want, right?
One of the questions I do have, though, is are there any Neath Talbot patients now at the moment in Kevin Coyd Hospital? Obviously being isolated at the moment for 14 days. And if so, are they going to stay at Kevin Coyd or are they going to return to Torna? Because obviously there's an emergency closure there. So they basically saying that there's 2 or 3 patients in the bed. So I'd be really pleased if we could find out how many patients are in Kevin Coyd from Neath Talbot at the moment.
I think that's one of the list of questions that you might want to send after the meeting, because it's specific information, it's statistics and details. Yeah, that's a good question, though. What Councillor Edwards mentioned about Kevin Coyd, I was going to ask, it was page 189 I was referring to, that Kevin Coyd is being promoted as a single point of access. We would want to be raising our concerns about the travel distance from places such as Glencorrwg, for example. But there was also a question that Councillor Alan Llewellyn, who doesn't sit on this committee, but would love to have come to attend, but he had a clash with the local meeting. And he was wondering about cross-boundary cooperation, because apparently where he is in Ystrefera, there is a mental health facility in Ystragynllais, which is about a mile away from his community, but it's a different health board and there's no cross-border cooperation. So I think it would be a good idea to include that in our letter. I do think we're actually coming to the end, however. So we can have Suzanne's proposing. Would you like to propose again?
Yes, I'd just like to take a bit of advice from Charlotte Democratic Services as to how we can word that we demand that they come. I mean, the letter definitely. I think committee are on board with writing the stern letter, but the wording, I'm struggling, Charlotte. How could we actually not invite them, but some other way?
Yeah, sorry, you've kind of put me on the spot here. I'm in the middle of messaging Craig as well at the same time.
Oh, I'm sorry.
No, it's all right. It's not a problem. I'm trying to check in the Constitution whether we have a right to compel.
Okay.
So I'm just checking with Craig. He's actually typing back to me at the moment. Yeah, and he's confirmed, because I was under the same impression. We haven't got a right in a way to compel.
So it is an invitation then?
It would be an invitation, yeah. So I know it would be lovely to summon, but unfortunately with the powers of the Scrutiny Committee, it would be an invitation basis.
Okay. On that basis, then, you know, my proposal is, as it was, that we as a committee write a letter expressing that, you know, very concerned that we weren't involved, and that we would like them to attend our committee, the next available committee that they can actually come to. But then if you do that, you're leaving it open for them to just say, oh, well, we can't make it, we can't make it. So I don't really know how to word it, Chair.
Right.
Chair, I don't know if you want to come in, sorry. I was just going to say, I think just in terms of yourselves, I wouldn't worry too much about when they could come. I think as long as you're happy to just have a letter drafted by the chair, sharing the concerns of the committee and including it that we invite them to attend a special meeting, and we will make every effort to find a time and a suitable date for them to attend. I think as long as we keep it quite simple, we can worry about that outside.
Well, are you happy for me to leave the wording to you and Charlotte then? That the essence is that we write a letter and that we invite them to come and speak to us.
I can see that the director wants to come in, but I just want to clarify something here for everybody on the committee. There's 2 things. We would like the health board to come, but we also, and I think this is critical, want to raise every issue that's been raised in this meeting today in the form of a letter, so that the worst case scenario is we write all these questions and we have a written response. because that will colour what we actually do and what we ask in the actual meeting. So, and I can see the director wants to come in, but I just want absolute clarification from the committee in the form of nodding heads or thumbs up. Are we right in saying that what Suzanne is proposing is that we write a letter to the Health Board expressing our concerns as worded and as verbalised in today's meeting? Yes?
Yes, Chair.
Yes? Nod?
Yes.
Yes, Chair.
Thank you. And at the same time, request that they come to a meeting to discuss the issues that we've raised. Is that what we're saying?
Yes.
Thumbs up, somebody?
Yes, Chair.
Thank you. Right, did that make sense? And sorry, Andrew, you've been very patient. But Charlotte, you happy now with what the wish of the committee is? Yeah?
Yes, I'm happy with that. I'm following what Andrew Jarrett says. We can come back to it for the committee.
Do we need a proper, a formal vote on that, Chair? Or
I just want to see what Andrew wants to say first.
Okay.
Yeah. Yep. So
Yeah,
you're back on hold again, Suzanne, right?
Yeah, I wasn't going to contradict any of that. I was just going to provide some reassurance. So, whilst we might not be able to compel the health authority, they do have a moral duty, I would argue, to attend. And it won't just be your letter that they will be hearing. So I will be working on this behind the scenes now from tomorrow to make sure that they understand that you're expecting them to be in front of you within a reasonable period of time to answer some of the questions on this consultation. So it was just really to add that I will be working behind the scenes to make sure this happens as well.
I think we're making progress. Excellent. So now, Suzanne, finally, you can make your proposal, somebody can second it, and we can move on. Yes, Suzanne.
Right, so I propose that the committee writes to the Health Board, raising all the concerns that have occurred during this meeting, and also then ask them to attend a meeting with us so that we can discuss them in person.
Excellent. I can see the cabinet member indicating, but I really want to take a seconder and move on with this, and then I'll go back to the cabinet member, unless it's absolutely critical. Peter.
A second.
No? Somebody seconded.
A second.
Right. Thank you. So we've done that bit. Yeah. Now, Councillor Richards, cabinet member, your contribution.
Can I thank you, Chair? I welcome this stance from the Scrutiny Committee. As Adrian has said earlier on, this has been on the cards for 2 years. I actually raised it in a regional partnership board. Andrew was present 2 years ago, and it's just been run over, and now it's obviously hit us. So I do support the decision, and I welcome the stance of this committee. Thank you.
Thank you. There's no recommendation. It's for noting. We've decided what we're going to do, and that's absolutely excellent. Okay, so we're now moving on through the agenda, and thanks to my Democratic Services Officer, I think I know what I'm doing. So we are noting the Cabinet's Forward Work Programme, and the Scrutiny Forward Work Programme is attached for information. We have no urgent items. So at this point, we need to resolve to exclude the public for the following items pursuant to Regulation 4, 3 and 5 of Statutory Instrument 2001, number 2290, and the relevant exempt paragraphs of Part 4 of Schedule 12A to the Local Government Act 1972. So, would somebody like to propose that we move into private, please? Can I have a proposer?
I'll move, Chair.
Thank you. And a seconder, please. Thank you.
I'll second.
Thank you ever so much. At this point in the meeting, I would like to thank any members of the public and press for joining us this afternoon. But could I please ask that you now leave the meeting? Could I also please ask that the recording of the meeting is now stopped?
Yes, Chair, I'll stop the recording now.
Okay, I apologise for my phone ringing. Sometimes